He will be our expert presenter. Before we jump in, I do want to take a second and just thank everyone for showing up. I know time is the most valuable non-renewable resource you have, and I do want to respect that. Would expect this Medicare webinar to take about an hour or so, maybe a little bit less, plus however long it takes to answer your questions at the end. I do want to take a couple quick minutes and introduce our team of certified financial planners, and then go over some ground rules for today's presentation. Then I'll introduce our speaker, and we'll go ahead and get started. We do have two certified financial planners on our team. The first is myself, Logan Whitlock. I've been working here for 9, going on 10 years now. What I do is primarily focus on retirement and retirement income planning. So we're answering questions like, when can I retire? How much can I spend in retirement and not run out of money? When should I take Social Security? How does Medicare work? And then our other certified financial planner is Linus Whitlock. He's our director of financial services. He's been working in the industry for over 30 years, and 19 of which have been partnered with Cheryl David. Back in 2004, Cheryl saw how devastating bad advice could be. And so she saw some of her estate planning clients who had received bad financial advice lose almost everything during the tech crash. And she decided to partner with Linus to make sure that never happened to any of her clients ever again. And they've been working together ever since. So if during this presentation you have any questions about the presentation, feel free to click on the questions or the Q&A button at the bottom of the screen. Just go ahead and type them in at any point. We'll plan on covering most of the questions at the end during the Q&A session, or if it happens to be particularly applicable to a slide we're going over at the time, we might cover it sooner. One last point before I introduce Mr. Clark and go ahead with the webinar. Medicare is one of the most important pieces of a successful retirement. And just with Medicare, there are countless little nuances. Like if you wait too long to sign up, you could increase your Medicare cost for the remainder of your life. And there are little nuances like this for every part of your financial life, from taxes to investments to 401ks, IRAs, insurance, Social Security, estate planning, and the list goes on. If you think you would find some value in a free, no obligation financial review after this is over with our two certified financial planners, I'll put a Calendly link in the chat. We can click on that and set up a time, or I'll put in a phone number. You can just give us a call and we can set up a time to do a complimentary review. But last but certainly not least, I would like to introduce our speaker today, Mr. Tom Clark. He has over 30 years of experience working directly with the Social Security Administration, who runs Medicare. Over the decades with the administration, he's done over 6,000 speeches and presentations, more than any other employee in the administration's history. He was awarded 2 of Social Security's highest honors, the Social Security Commission Citation, and 4 of the Deputy Commissioner of Communication Citations with excellence, and explaining the complications and the complexities of Social Security and Medicare. If anyone knows his subjects, Tom Clark does. And without further ado, I'll turn it over to Tom Clark to tell you all about Medicare.
Well, thanks. Thanks, Logan. First of all, I want to reiterate, I want you to feel free to ask your questions. I've got nothing to do this evening but this, so I'll stay as long as you have questions at the end. And I find people on webinars don't ask as many questions as they do in person, but really the most valuable part of these are answering your specific questions. And as you heard, I've done over 7,000 presentations, so you're not going to ask me anything I hadn't heard before, more than likely. I used to tell people that, and I found they accept that as a challenge, but more than likely you're not going to. And I want to, before I even get into the presentation, I want to kind of get us on the same page at the start, because the PowerPoint doesn't really explain what the different parts of Medicare are until we're further into it. So I want to get us straight right from the start. The 2 basic parts of Medicare are Medicare Part A and Medicare Part B. Part A is the hospital insurance part of Medicare. It pays the hospital bill itself when we're in the hospital. Then doctor bills and outpatient treatment, those are paid for by Part B of Medicare. Back to Part A. People think Part A is free, It's really not. It's just a matter of when we pay for it. We pay for Part A while we're working, so we don't have to pay for that once we are retired. If you qualify to draw a Social Security check based on your own work or your spouse's work, even if you're not drawing that check yet, then once you're 65 and over and retired, Part A won't cost you anything because you or your spouse paid for that while you were working. If you're working right now, look at your pay stub, you'll see that the FICA tax is divided into two parts. 6.2% is for Social Security, 1.45% is Medicare. That's what funds Medicare Part A. Then Part B covers doctor bills and outpatient treatment. And Part B does have a premium. For most people this year, that premium is $164 a month. If you're drawing a Social Security check, just hold that out of your Social Security check. If you're not receiving your Social Security yet, there's different ways you can pay for that till you start drawing your Social Security checks. And that $164 a month that most people are paying for Part B, that's only 1/4 the cost of Part B's premium. The federal government pays the other 3/4. So every month somebody pays $164 for their Part B. For that same one person, for that same 1 month, the government paid $492. We pay 1/4, the government pays 3/4. Now, if somebody has income above $97,000 for an individual or $194,000 for a couple, they don't get that full 75% subsidy from the government. So they pay more than 1/4 the cost. And how much more they pay depends on how much their income's above $97,000 for an individual or $194,000 for a couple. Here's the issue though. Social Security has no idea how much income somebody has this year or even last year. So they have to base that higher premium on somebody's income 2 years before. So here in 2023, that higher premium is based on people's 2021 income. Next year on the 22 income and so on. But if somebody's income has gone down in the last 2 years because they retired or became widowed, they can ask they base that premium on their current income, not their income 2 years ago. So if you and your spouse have good jobs, you retire, you file for your Medicare Part B, and then you get a letter saying, based on your income 2 years ago, we have to charge this higher premium. But your income's gone down because you retired, then be sure and let them know because they don't know unless you tell them. Just the fact that your income has gone down since 2 years ago does not mean you don't have to pay the higher premium. It has to have gone down for certain life-changing events. The most common of those are retirement or becoming widowed. There are a few others though, and they list all those on the letter they send you saying you have to pay that higher premium. So if you get that letter saying you have to pay the higher premium, your income's gone down, look to see it's gone down for any of those life-changing events. If so, be sure to contact Social Security so you don't have to pay the higher premium. And then, as I said, Part B covers doctor bills and outpatient treatment. And when I say Part B covers doctor bills, that's all doctor bills. If you've been in the hospital, then you know when you get out, you get the hospital bill in the mail. Then you get bills from doctors you saw. Then here come bills from doctors you didn't even see. Since those are doctor bills, Part A does not cover those. Those are paid for by Part B. So Part B covers all doctor bills in and out of the hospital and outpatient treatment. So Part A, hospital inpatient. Part B, doctors and outpatient. And then Part D, D like drugs, D like dog, that's for prescription medications. And I just kind of want everybody to be on the same page before we get into the body of this. So we're going to cover briefly the history of Medicare and then the steps of Medicare enrollment. The most important thing, we'll talk about timing, making sure you file for your Medicare different parts at the right time. And that's critical. One thing, the timing really involves Medicare Part B. And the number one thing to remember that from this seminar, the number one thing to always remember is once Medicare is your primary payer, once Medicare is paying first, you've got to have Medicare A and B in place. Because once Medicare is the primary payer, nobody else will pay anything Medicare will pay for except Medicare. And we'll talk about when Medicare is not primary. That's really the crux of the whole seminar here. But once Medicare is paying first, you got to have Medicare A and B in place. We'll talk about the steps to Medicare. As I said, it's the step, importance of timing, the types, how to access it. And so let's get into the history of Medicare. Medicare started in 1965. And these programs, once they've been around for a long time, people forget what it was like without them. But before Medicare started in 1965, if you were 65 and over, the only way you had health insurance was if your employer gave it to retirees. Back then, more employers did that. But other than that, you couldn't buy health insurance at 65 because you were uninsurable. We are uninsurable once we turn 65. You cannot expect private insurance companies to insure 70 million of us when we're uninsurable at a price we can afford because it all go bankrupt. So only the government can insure us when we're uninsurable by that kinds of numbers. So what Medicare means is we still have access to health care after age 65. That's why I say it's worth more than Social Security, because that's worth more than money. So that was in 1965, average life expectancy was 70. As you see, it's gone up to 79 now. And says people are living longer, and the population's grown from 19 million enrolled in 1965 when Medicare started to 60 million now, and growing at the rate of about 15,000 a day, because as you'll see on this next slide, well, next slide further down, it says 10,000 baby boomers turning 65 each day, but that's old news. It's now about 15,000 people turning 65 every day of the year. As I said, there's a lot of us baby boomers. Now, here's a question I get a lot. Why is Medicare so confusing? Sorry about that. Why is Medicare so confusing? Why does it have to be so complex? How does a normal person do this? Which is a very good question, actually. And one answer to that I always tell people is watch what you ask for, because you just might get it. When Medicare first started, it was a one-size-fit-all program. If you didn't like it, tough. That's all you had. This one program, no options in it. Because of that, people, senior citizens, and people that advocate for seniors kept asking for choice. They kept telling Congress, we want choice in Medicare. Congress listened. They gave us choice. That's good, but choice means complication. We have to make choices now with Medicare. And that's fine when we're 65 or 75, maybe 80. But when you're 91, like my mother, she's doing very well, but still those things seem overwhelming to her to have to make those choices. And so who do you go to for help? Hope you'll go to your financial planners, because you'll see there's lots of people offer lots of help that may not know what they're talking about. About 15,000 baby boomers turning 65 every day. If you're nearing 65, you know what that mailbox collection is. The joke is, as you get to P65, you need to buy a bigger mailbox, because it seems like every single day you get flyers, letters from every insurance company that sells Medigap policies in your area, every Medicare Advantage plan. I told you Medicare was complicated. There are 36 different enrollment periods. And I don't know anybody that would know every single one of those without at least looking one or two up. But we're going to be involved in three. We're going to talk about the initial enrollment period, which is a 7-month period, the 3 months before we turn 65, the month we turn 65, the 3 months after. That's the initial enrollment period. Then we'll also talk about a special enrollment period, and that's for people who are working past 65. We'll talk in detail about this, who don't need to take Medicare yet, because in some instances, when you're working past 65 Medicare secondary, they get a chance to take Part B when they retire. It's called a special enrollment period. And then the third one is one we don't want anybody to have to use, because if you're using this third one, you've made a mistake and you're going uninsured for doctor bills for a while anyway. And that's called the general enrollment period. That's the first 3 months of each year. It's for people who made a mistake and did not take Medicare Part B when Medicare became primary, they get a chance to, the first 3 months of each year, to file for Part B and get it in place. We don't want anybody on this call to have to use that one, because that means you made a mistake and you are going uninsured for doctor bills for a length of time. Now, people sometimes wonder, why is somebody who's retired from Social Security talking about Medicare? Well, Medicare and Social Security are two separate programs. And Medicare is a program of an agency called CMS. But Social Security is Medicare's biggest contractor. Medicare pays Social Security to do the entitlement part of Medicare. So we go to Medicare to enroll in Medicare, and we go to Social Security to enroll in Medicare. Social Security collects the premiums and all of that. What Social Security doesn't do is they're not involved in what does Medicare cover, what types of services, medical services does it cover, how much does it pay for those. Medicare does that through other contractors. But what people need to know at this point in their lives is the Social Security part of it, the entitlement part. That's what we're talking about today, is the part of Medicare that Social Security administers. So who to go to for help? Well, you could go to your doctor's office. There's some help there. Neighbor or friend, do not go to neighbor, friend, or relatives. Since Thanksgiving is coming up before too long, a little bit of advice. Anything your brother-in-law will tell you on Thanksgiving Day about Social Security and Medicare after watching football and eating turkey will be wrong. Anything your coworkers tell you about Social Security and Medicare will be wrong. Anything your neighbors tell you over the back fence about Social Security and Medicare will be wrong. I've worked in this area for over 40 years. I haven't found one exception to that yet. And so the person to go to, HR is not a bad choice. Lawyers, certain things, but actually people to go to are your financial planners, your financial professionals. Your financial planners are going to know a lot of those questions. Also, they know if you have a very complicated one that they don't know, they know where to go to get that answer. They're not going to make it up like your brother-in-law on Thanksgiving Day. They're going to make sure they find you the correct answer. So your financial planners are the people to go to for those questions. The steps of Medicare. Now, Medicare itself says that Medicare is a three-step process. Select your plan, enroll in Medicare, enroll in the plans. We think that's a little too simple. We think actually Medicare is a six-step process. First of all, check your timing. That's vital. Make sure you're enrolling in Medicare Part B, for example, at the right time, because if you don't, you could go uninsured for a while. Choose how you want to access your Medicare. We'll talk in detail about this, but do you want to go with the original Medicare, which means there's no network? Go to any doctor, accepts Medicare anytime you choose. Or do you want to go with something called Medicare Advantage, which is the managed care part of Medicare, where you have a network? Once you choose the type of coverage, then you have to choose the type of plan you want. Then you enroll in Medicare, then enroll in the plan you chose, but you're still not finished. Because, for example, if you're in original Medicare where there's no network, for your prescriptions, you buy something called a standalone Part D plan. If you go with Medicare Advantage, those usually include Part D. Both of those you can change once a year. So for example, if you have a standalone Part D plan, because you're in original Medicare, and your needs change, your prescriptions change, and maybe another plan will cover those better than the plan you're in, then in the autumn, from October 15th to December 7th, you can change plans for the next year for one that'll cover those medications better. If you're in a Medicare Advantage plan and your needs change and another Medicare Advantage plan might be better for you, in that same time period, October 15th through December 7th, you can change to another Medicare Advantage plan. So you're never really through, because you do need to make sure you're in the best plans for you as your needs change. That little blurb at the bottom says just one Medicare mistake can cost a person thousands of dollars and often cannot be undone. That is all true, but I would change one word in that. I would change thousands to millions. And that's not an exaggeration. people are always telling me how much Medicare paid for them or their mother and father in 1 year. And you'd be amazed how often that's well over $1 million in 1 year for one person in hospital and doctor bills the Medicare pays. The record for me was one night I was doing a seminar, and this attendee raised her hand and said that the year before, Medicare had paid $2.1 million for her mother in one calendar year. That was over $1 million in doctor bills. Her mother had Part B of Medicare, but if she hadn't, that would have been her $1 million bill to pay. Because as I said, once Medicare is your primary payer, nobody will pay anything Medicare will pay for except Medicare. So timing. So is it best to enroll in Medicare at age 65 or delay? These are the factors we'll cover. These are the factors that go into that decision. Number one, are you receiving Social Security benefits? Number two, what kind of health insurance do you have? How good is it? Number three, are you working? If you are working, how big is your employer? And are you covered by that employer's health insurance as an active employee? Do you have something called a health savings account, also an HSA? Let's take the Social Security one first. So this is the only time enrollment in Medicare is automatic. If somebody is already receiving Social Security before age 65, they don't have to contact Social Security again to file for Medicare. If they're already receiving Social Security before age 65, then Medicare enrollment is automatic. Social Security will send them their Medicare card automatically about 6 to 8 weeks early. And Social Security will make an assumption in this situation. They're going to assume this person wants both Part A and Part B. Now, they have to keep Part A no matter what. The law says if somebody is 65 and over and receiving Social Security benefits, they're automatically enrolled in Part A. They can't turn it down. If they need Part B, in this situation, they just keep the card that's sent to them automatically. They automatically have both Part A and Part B. If they don't need Part B, and we're going to talk about that in detail, but if they don't need Part B, there's a place they can turn that card over, sign that they're refusing Part B, an envelope to mail it back to them, and then they'll get a new card showing they have Part A only. But as I said, this is the only time Medicare enrollment's automatic is that they're already receiving Social Security before age 65. Second situation, if they're not working when they turn 65, or if you're working, but you don't have insurance from your employer, or maybe your employer's insurance is so bad that you're going to love to turn 65 because you'll get a lot better insurance from Medicare at a lot cheaper price, and that happens a lot these days. And that in those situations, if you're not covered by health insurance when you turn 65 from active employment, you've got to have Medicare A and B in place because Medicare is your primary payer. Also, if say you're retired from AT&T and work at another employer for a second career, but you didn't take the new employer's health insurance because you had health insurance as a retiree from AT&T. Since you're all retired from who you have your health insurance, you turn 65, you got to take Medicare A and B because AT&T says you're retired. Third situation, this person's working past age 65. They have insurance from an employer as an active employee, but this is a small employer. This employer has less than 20 employees. This is the only employer that is allowed by law to discriminate against their older employees. An employer of less than 20 employees can actually drop their active employees from their healthcare coverage when they turn 65. They can do that. I've never seen one do it, by the way. They can do that. But the reason I've never seen one do it is because they really don't have to, because they get to be secondary to Medicare. So if you're working for an employer of less than 20 employees and you turn 65, that employer's insurance becomes secondary. Medicare becomes primary. the first of the month you turn 65. So in that case, you've got to have Medicare A and B in place, because the employer plan is only going to pay part of what Medicare doesn't pay. Once Medicare's primary member, nobody will pay anything Medicare to pay for except Medicare. So if you're in this situation, you're covered by health insurance from an employer of less than 20 employees and you're turning 65, you've got to take Medicare A and B, because if you don't take Medicare B, you're going to pay the doctor bills out of your pocket because Medicare is primary. As a matter of fact, the employer's insurance won't even pay anything at all on doctor bills if we don't have Medicare Part B. Because once somebody's insurance is secondary, once this employer is a secondary to Medicare, they're going to wait to see what Medicare pays on those doctor bills before they pay. If Medicare never pays because this person didn't take Part B, the secondary coverage doesn't ever pay either. And so somebody in this situation covered by active employment for employer of less than 20 employees, they don't take Part B, they just made themselves Medicare. They'll pay the whole cost of those doctor bills out of their pocket until they get their Part B back. And these are very important. So if you have questions, be sure and ask those. As I said, I'll stay as long as you have questions. This next one, this is the only time a person does not need Part B of Medicare. This is the only time. Every other situation, Medicare's primary, you've got to have Medicare A and B in place. But in this situation, Medicare is secondary to the employer's insurance. So when you turn 65, if you're working for an employer of 20 or more employees at that point, and you're covered by that employer's health insurance as an active employee, then while you're still working with that employer past 65 and maintaining that healthcare coverage, Medicare pays second, the employer's group insurance has to pay first. Medicare does not force you to pay for Part B of secondary coverage. So when you turn 65, if you're still working for an employer of 20 or more employees, you're covered by that employer's health insurance as an active employee, then you don't need to take Part B. You can wait until you retire. You get that special enrollment period to get your Part B in place at that point. You'll start right away. There'll be no penalty. But you need to remember to contact Social Security and file for your Medicare Part B at retirement, because the month after retirement, Medicare starts paying first in this situation. Works for your spouse too. Let's say that you're working for an employer of 20 or more employees. You've got that employer's health insurance in place as an active employee, and you have your spouse on that insurance, and your spouse turns 65. That's the same as them working down there. Medicare is secondary for your spouse until you retire. Your spouse gets that same special enrollment period to get their Medicare Part B in place right away with no penalty when you retire. In this situation, the employer cannot give you an incentive to drop their health insurance and go with Medicare's primary. They cannot pressure you to drop their insurance and go with Medicare's primary. Both of these would be violations of federal law. You can choose on your own to drop the employer's health insurance and go with Medicare's primary. Maybe an employer has really bad health insurance, but the employer cannot pressure you or give you an incentive to do that. It has to be your decision only. So let's take that situation. Medicare secondary, because this person is covered by their or their spouse's active employment for an employer of 20 or more employees. Should they take Medicare Part B when Medicare secondary? Should they take Medicare Part A when Medicare secondary? Let's take Part A first. When Medicare secondary in this situation, a person might want to take Part A. It does not cost them anything. That have secondary coverage on a hospital inpatient stay. If they went into the hospital while they're still working that employer, the employer insurance would pay first on the hospital bill. Medicare Part A would pay second. Part A doesn't cost them anything, so they might want to take Part A when Medicare is secondary. But in one situation, they might not want to, and that's if they have something that's called an HSA, which stands for Health Savings Account. Now, first of all, this is not your flexible spending that you lose at the end of the year. This is not that. This is your actual health insurance, has a high deductible, and you get to put tax-free money in that HSA to help you pay in the future for out-of-pocket costs. Well, the law says you cannot put any more money in an HSA once you are entitled to any part of Medicare. So this person working past 65 for the employer of 20 more employees, if they had an HSA and took Medicare Part A, they can't put any more tax-free money in that HSA. Also, as I mentioned before, the law says anybody 65 or over who's receiving Social Security benefits automatically has Part A. They can't turn it down. A lot of people who are working past 65 start drawing their Social Security at their full retirement age, because at that point, there's no limit on their earnings. They can keep on working full time and draw their Social Security once they reach full retirement age. So somebody working past full retirement age takes their Social Security then, they will be entitled to Medicare Part A. They can't put any more money in that HSA. Let's go a little further in this situation. The Medicare law was written way back in 1965, decades before the law that established HSAs. And sometimes when that happens, the laws don't sync together perfectly and they don't hear. The original Medicare law that still applies states that if someone does not take Medicare Part A when they turn 65, then when they do file for either Medicare Part A or Social Security later, they will be entitled to Medicare Part A 6 months retroactive. Their Part A will start 6 months before the month they applied for either Social Security or Medicare Part A. That is a law. Social Security cannot stop that from happening. So if you don't take Medicare Part A at age 65 because you want to keep putting tax-free money in that HSA, you need to stop making those contributions to the HSA 6 months before the month you're going to apply for either Medicare Part A or Social Security, because your Part A will start 6 months retroactive, 6 months before the month you made that application. If you don't have an HSA, you might as well file for Part A when Medicare secondary, because it doesn't cost you anything. You'd have secondary coverage on a hospital bill. So let's go back here and talk about Part B in this situation. So the situation, once again, is Medicare is secondary because this person is covered by their active employment or the spouse's active employment for an employer of 20 or more employees. So Medicare secondary. Should they take Medicare Part B when Medicare secondary? The answer is probably not. And this is why. We all know that most employers have eliminated retirees' health insurance. 30 years ago, most big corporations gave the retirees health insurance. They got to keep into retirement and past 65 to pay secondary to Medicare. For most employees, that is eliminated. Most employers no longer offer that. So most people working past 65, when they retire, they're going to want secondary coverage to Medicare. And we'll talk more about that in a little bit. So a lot of people who work past 65, when they retire and lose their employer's health insurance, they're going to want to buy something called a Medigap insurance policy, also called a Medicare supplement. It's a private insurance product that you buy to help pay what Medicare doesn't, the about 20% of the hospital and doctor bills that Medicare doesn't pay. So you're buying this from an insurance company. Would insurance companies like to sell health insurance to who? Healthy people. They don't like to sell health insurance to people that are already sick. Now, I don't blame them, but they don't like to. So the government's got a law to protect us as individual consumers. What that law states is the first 6 months you are entitled to Medicare Part B. You have what is called a guaranteed issue right. If you go to an insurance company and you tell them, I want to buy your Medigap policy, if at that point you have been entitled to Medicare Part B for less than 6 months, the insurance company cannot turn you down or charge you a penny more, no matter how sick you might be. But once you've been entitled to Medicare Part B for more than 6 months, you go by that Medigap policy, they can turn you down or charge you whatever they want. So let's take an example of somebody who might be tempted to go ahead and take and pay for Part B from Medicare secondary. So this person we're talking about is an active employee for an employer of 20 or more employees. They've got that employer's health insurance as an active employee, so Medicare secondary. But even though they're still an active employee, they've got a serious illness. And they're having to go to the doctor several times a week. And every time they go, there's a copay or a part of a deductible. And those out-of-pocket costs are adding up to be a lot of money. And this person's now turning 65. They might be tempted to think, I ought to take Medicare Part B now because it'll help pick up a lot of those out-of-pocket costs as a secondary cover. And it might pick up a lot of those out-of-pocket costs with their secondary coverage. But here's the danger. Let's say that person took Part B at age 65 and Medicare was secondary. 3 years later, at the age of 68, they retire. They've been entitled to Part B more than 6 months, haven't they? They've had it in place for 3 years. They retire and go to buy that Medigap policy. They very likely will be turned down and charged a lot more because they're already sick. But if they'd waited to take Part B when they retired in that special enrollment period, they would have had it in place less than 6 months. They have that guaranteed issue right. They go to buy a Medigap policy. They can't be turned down or charged a penny more, no matter how sick they might be at that point. So that guaranteed issue right is a very valuable thing. You don't want to waste it when you don't need it. You want to save it for when you need it, which if you work past 65, you need it when you retire and lose the employer's health insurance. It is complicated. Be sure and ask questions if you have those. And one last thing about staying in a high deductible plan with an HSA. This concerns Medicare Part D. Medicare Part D for the prescription drugs. The Part D law states that when somebody turns 65, if they don't have what is called creditable coverage for prescriptions, creditable means as good as Part D. So when somebody turns 65, if their coverage for medications is not as good as Part D's coverage, then they'll pay a penalty. They'll pay a higher premium when they get their Part D in place at retirement for the rest of their life. Well, if you have a HSA, that means you have a high deductible health insurance. That's automatically not as good as Medicare Part D because Part D does not have a high deductible. So if you just do stay in a high deductible health insurance plan with an HSA past 65, you will pay a higher premium Part D once you get it at retirement. It's 1% higher for each year you didn't have that as good a coverage. That's not as bad as it sounds. It's 1% higher for each month you didn't have as good a coverage as Medicare of Part D's basic premium, which is about $35 a month this year. So it's not a huge deal. Just be aware that will happen, though, if you do stay in a high deductible health plan past 65. Now, a lot of employers don't have any other health plan available, so you're kind of stuck with that in a lot of situations. Now, I have run into very few, but some people have a high deductible health plan with the HSA, but their prescription drug plan is separate without a high deductible. In that case, you might not have to pay the higher premium, but that is very, very, very rare. Most of the times, the prescriptions also have a high deductible. And then this situation, if you're not working when you turn 65, then Medicare is going to be your primary payer. If you're not working when you turn 65, Medicare is your primary payer. You've got to have Medicare A and B in place. COBRA is not active employees health insurance. So COBRA is secondary to Medicare. If you're on COBRA when you turn 65, you've got to have Medicare A and B in place. Of course, in reality, if you are on COBRA, you're going to love to turn 65 because you can drop the COBRA and get a lot cheaper health insurance, go on Medicare and buy your Medigap plan. Retirees insurance, if you are lucky enough to work for an employer that offers retirees health insurance, you get to keep past 65. It becomes secondary to Medicare once you're 65 and over and retired. So you still got to have Medicare A and B in place because it's going to be secondary to Medicare once you turn 65 and are retired. If you had a severance package, your employer offered you 2 years, for example, of health insurance. If you took the severance package and you turned 65 during that 2-year period, severance package insurance is not active employees health insurance because you are not still working there. You actually can't go back to work there if you take a severance package. You sign that you're not going to ever go back to work for them again. And so if you're On a severance package, insurance turn 65, you got to have Medicare A and B in place because Medicare is going to be primary. Let's talk about those enrollment periods. The initial enrollment period is 7 months surrounding your birth month. Special enrollment period is 8 months from the time you retire if you work past 65 to your employment the first 3 months of the year for those who made a mistake. Let's go back to the initial enrollment period. I know technically, legally, it's 7 months long. In my opinion, it is not 7 months long. It's only 3 months long because I don't want anybody to have 1 second's gap in coverage. So this person is not covered by active employment from employers 20 more people. They're not covered by that, but they're not taking their Social Security yet. They're retired, for example, but they're not taking the Social Security because they want to wait till full retirement age, for example. They want to get a bigger check. But they're turning 65, they're not working. They need to file for Medicare because you can file for Medicare without filing for Social Security. This person needs to file for Medicare in their initial enrollment period. As long as they applied for Medicare before the end of the month, before they turn 65, then Part B starts the month they turn 65, there's no gap in coverage. So let's say somebody was turning 65 in November. They need to file for Medicare in this initial enrollment period. As long as they have filed before the end of October, the month before they turn 65, then Medicare Part B will start November 1st, the month they turn 65. There's no gap in coverage. But if this person waited until the month they turn 65, so they waited until November, the month they turn 65 to file for Medicare, their Part B won't start until December 1st. They have no coverage for doctor bills for the whole month of November. I'd be afraid to get out of bed if that was me. It's even worse if you file later in that initial enrollment period. So if you do need to file for Medicare during that initial enrollment period, it's really only 3 months long. Be sure and file for it at the very latest before the end of the month, before you turn 65, so you won't have a gap in coverage. And let's talk about anybody who happened to be born on the first of a month. There's a legal principle out there that I think applies to every law. It just doesn't matter with most laws, but it matters a lot with Social Security and Medicare. That principle is you actually attain an age the day before your birthday. So if somebody's 65th birthday was November 1st, then legally they turn 65 October 31st. Their Medicare is effective October 1st. If they're filing during that initial enrollment period, they needed to file before the end of September, the month before they legally turn 65. So if you're born the first of a month, everything with Social Security and Medicare happens a month ahead of time. Very important to keep that in mind if you need to file for Medicare in that initial enrollment period. Now, the special enrollment period, this is the one for people who, when they turn 65, were still working for an employer of 20 or more employees, covered by that employer's health insurance as an active employee, or the spouse of somebody who's working for an employer of 20 or more people, and they're on the spouse's insurance for that, on their self-insurance as an active employee. And they're retiring after age 65. The law says that that special enrollment period to file for Part B when you retire past 65 like that lasts for 8 months. Once again, I don't believe that because I don't want anybody to have 1 second's gap in coverage. In my opinion, this special enrollment period is 1 month long. Let's take an example. Let's say this person is 68 years old. When they turned 65, they were still working for an employer of 20 more employees, and they had their health insurance, that employer as an active employee. So they didn't take Part B because we said they shouldn't, because Medicare has been secondary all this time. And let's say they're retiring today, anytime in September. They're retiring in September, and that at the age of 68. In that situation, Medicare becomes primary the first second of the following month. So if this person retired at age 68 in September, Medicare becomes primary the first second of October. Then have to the end of October to file for the Part B, have a retroactive start October 1st, there'd be no gap in coverage. But this person at the age of 68 retired in September and waited until November to file for the Part B. The second of that 8-month period, the Part B wouldn't start until December 1st. to have 2 whole months without any coverage for doctor bills, once again, I'd be afraid to get out of bed if that was me. So if you do work past 65 like that for an employer of 20 or more employees, and you cover that employer's health insurance as an active employee, so Medicare secondary, I'd encourage you to file for your Part B about 3 months before you retired. That gives Social Security time to get your new Medicare card to you, showing you have Part B by the time Medicare becomes primary. Let's say you're planning to work a little longer, plan to work till 70, but something happened when you were 68, you had to retire all of a sudden. Then be sure and file for a Part B at the very latest before the end of the month after retirement to not have a gap in coverage. And then that general enrollment period, we don't anybody on this call to have to use that because that means you made a mistake. For somebody who didn't take Part B at the time they became 65 and over and didn't have health insurance from active employment from 20 more people, somebody didn't take Part B at that point, then they realize, oh, I've made a huge mistake. I'm going to run down the Social Security, get my Part B back. When they get out of the office, they got some good news for them down there. They got some bad news. The good news is, yes, they can get the Part B if they didn't take it when they should have. The bad news, they can't get it back today. Somebody does not take Part B at the time they were 65 and over and Medicare was primary. To get their Part B, then they have to wait till the first 3 months of a later year to reapply for it. It won't start till the month after they applied. It used to be they had to wait till July 1st to get it. That changed this year. So there's a little mistake there on the PowerPoint. So for example, if somebody didn't take Part B when they should have, they apply for it this coming January, the Part B will start February 1st. They don't have to wait till July any longer. And then also, though, they're going to pay a 10% penalty on that premium for each year they didn't have Part B and should have. So that $164 premium will be 10% higher for the rest of their life for each year they should have had Part B and didn't take it. The reason that law is, if that law wasn't in place, what would happen is people would take Part B and pay for it when they were sick. And when they got well, they'd cancel it. And when they got sick, they'd pick it up again, which means it would no longer even resemble insurance. That would drive the cost up so high, nobody could afford even 1/4 the cost of it. There's those penalties. This person should have had Part B 3 years ago. So he's paying a 30% higher Part B premium for the rest of his life. That's almost $50 a month this year. There's the Part D. This person had 4 years where he didn't have that as good a coverage for prescriptions as Part D has. So he's paying 48% higher premium of the basic premium for Part D. So this person listened to her brother-in-law on Thanksgiving Day, and he told her no matter what, you've got to have Medicare A and B in place when you turn 65. But when she turned 65, she was still an active employee for an employer with 20 more employees. Cover that employer's health insurance as an active employee. So Medicare was secondary. She didn't need to take Part B. First of all, she paid over $5,000 in premium she didn't need to have paid. But that's not the real problem. The real problem is she no longer has that guaranteed issue right. If she gets sick before she retires, she might not be able to buy that Medigap policy, or they may charge her a lot more. She doesn't have that guaranteed issue right any longer because she's already had her that 6 months of Part B entitlement. She spent that while she was still working in Medicare was secondary. So don't listen to your brother-in-law on Thanksgiving Day. Here's a lesson there. So these are the pitfalls. Assume Medicare enrollment's automatic at age 65. No, that's only if you're already drawing Social Security. Believe you must enroll at age 65 no matter what. That might be the case, but not if you're covered by your or your spouse's active employment for employer with 20 more employees. Thinking that insurance such as retiree insurance is going to keep paying primary when you turn 65, so you don't take on Part A and B. Or putting money in an HSA while you're enrolled in Medicare. About 2 years after that happens, you're going to get a letter with the return address of IRS on it. Nobody wants that kind of letter. So type. How do you access your Medicare? Well, the most common option, original Medicare, which means there's no network. You buy that Medigap policy to help pay what Medicare doesn't. Medicare Advantage is like a Medicare HMO. You have a network. If you have retirees insurance, that's still secondary to Medicare. You still got to have Medicare A and B in place. If you qualify for VA coverage, I still think you ought to have Medicare Part B. This has happened a long time ago, but I used to be a supervisor a long time ago at the downtown Fort Worth, Texas Social Security office. And one day, this person was referred to me to talk to him. I was about the third person that this person was referred to. We were all trying to talk about turning down Part B. He said, I'm a veteran with a service-connected disability. I go to the VA hospital for all my medical needs. They don't charge me anything. They take care of all. They don't charge me anything. And as far as I know, that's probably all true. So he said, I don't need Part B. We could not talk him out of turning down Part B. It was his right to do that. He exercised that right. He turned it down. About a year later, he was back in our office looking for some help, which we couldn't give him. He'd been visiting relatives in a city where there's no VA facility. He'd had a stroke, and because of his condition, he couldn't be moved for 2 weeks. Now, his hospital bill was still mostly paid because he still had Part A. He couldn't turn that down. But this was well over 30 years ago. He had $50,000 in doctor bills and no Medicare Part B to pay for it. And the VA was not going to reimburse him for it. Now, people tell me, well, the VA pays for services outside of the VA hospitals now. Well, it does in some situations, but you have to set that up in advance. It's not for emergencies. So if you don't have Part B in place because you're relying on VA coverage, you have an accident out on the freeway, they're not taking you to the VA hospital, taking you to the nearest hospital for that emergency. You spend half a day in that emergency room, you've already spent more than a lifetime worth of Part B premiums out of your pocket for not having Part B in place. So in my opinion, even if you qualify for the VA, you still need Part B. When a veteran tells me they don't need Part B now, this is what I tell them. That's only going to work if you buy yourself a tent, pitch it in the lobby of the VA hospital, and never go anywhere else. That's the only way that'll work if you don't take Part B. And FEHB is actually retirees' health insurance for federal employees. It's all the same as retiree coverage. So Medicare technically has 4 parts. Part A is hospital inpatient insurance. Part B is doctors and outpatient. Part D is prescriptions. Part C is really not another part. Part C is actually those Medicare Advantage plans. So it's not really a different part of Medicare. It's just another way to access it. So they don't usually call it Part C anymore because that confused people. It's just the Medicare Advantage plans. Let's go in detail about these. But first of all, you do want secondary coverage to Medicare. Medicare pays about 20%, pays about 80% of the hospital and doctor bills. So Medicare pays about 80% of those hospital and doctor bills. Well, as we get older and sicker, and those total bills get higher, that 20% Medicare doesn't pay can be a whole lot of dollars. As I told you, Medicare, this lady told me Medicare paid over $2 million for her mother in 1 year. That's more than her husband, her kids, her grandkids, her nieces and nephews paid in total FICA taxes in their whole lifetimes all put together. So Medicare paid a lot of dollars for her in 1 year. But if that was 80%, that means Medicare didn't pay over $400,000 in 1 year, which to me is still a whole lot of dollars. You want to make sure you have secondary coverage to protect you against that kind of catastrophic health event, which happens more often than you realize. And so here's something I told you at the start, because I like telling this to start rather than wait until here. The basic parts of Medicare, Part A, which is hospital inpatient insurance. Part B is doctors and outpatient insurance. And Part D is prescription drug coverage. So the 2 types of Medicare. Original Medicare, Medicare Advantage. So original Medicare, administered by the federal government, of course. No network. Go to any doctor except Medicare anytime you choose. Your Medicare card is your identifier. You have to have A and B in place, what's Medicare's primary. But you have those out-of-pocket costs. There's deductibles and co-insurances. No catastrophic out-of-pocket limit. So to protect you against those kind of catastrophic costs, you need to buy that Medigap policy and, of course, get your Medicare Part D plan in place. And depending on which Medigap policy you choose, most, if not almost all, of your out-of-pocket costs will be covered. The Medigap policy, also called a Medicare supplement, you buy it from an insurance company to help pay what Medicare doesn't. Insurance companies do not make up their own Medigap policy. The federal government has standardized plans they have to fit into. So everybody's Medigap plan A is exactly the same as far as coverage. The plan that pays the most is Medigap Plan G. For example, somebody had Medigap Plan G this year. The most they'd be out of pocket hospital and doctor bills would be $226 for the whole year. So standardized plans, and the guaranteed issue right is that first 6 months you're entitled to Medicare Part B. They cannot turn you down or charge you a penny more. What I tell people when they're turning 65, or if they work past 65 and get ready to retire, at the point Medicare becomes primary, say at 65, don't buy the Medigap policy you want then. Buy the one you're going to want when you're 90. Because the insurance company will let you buy a cheaper, lower coverage Medigap plan when you're 65, and then at 80 switch over to a Medigap Plan G. And I don't blame them. You've got to think about it. Who do they make a profit on? They're 90-year-olds or they're 65-year-olds, right? Their profit comes from the younger and healthier of the senior citizens. And so they're not going to let you buy a cheaper plan and then switch over to a higher cost plan later. It's just not going to happen. So if you want Plan G, then get Plan G. The moment Medicare becomes your primary payer. My mother's almost 92. She's doing great. But I found as people get older, they get more anxious about things that didn't bother them before. Well, knowing she won't be out more than $226 in hospital and doctor bills for the year is one less thing to be anxious about for her. So get the plan you're going to want when you're 90. And after that, after 6 months, you're entitled to Part B. They don't have to sell it to you, as we keep saying. Some states have some additional guarantees, but not the state you're in or the state I'm in. So Medicare Advantage, it's like a Medicare HMO. Administered by a private insurance company. The insurance company makes the rules, but let me go into more detail about that. The federal government, Medicare, has set rules so the rules that the insurance company makes has to fit into Medicare's protections and rules. But they do get within those, get to make their own rules. They have their own identifying card. They provide Part A and Part B services, of course, hospital and doctor coverage. Most of them include Part D automatically. That's part of your decision-making process about which plan, Medicare Advantage plan to choose, which one covers your prescriptions better. Depending on if you live in a big city or not, you probably have zero premiums. If you live in a big city, smaller area, you might have very low premiums. They can add some things that original Medicare doesn't, like some vision, hearing, and dental coverage. Also called Part C sometimes, but really it's just another way to access your Medicare. So packaging of Medicare A, B, and D, but you have to stay within the network. You have to stay within the network. You're outside the network, you'll pay more. You usually have to go to your primary care physician before you go to a specialist. And then normally with the Medicare Advantage plan, you have copays. But the way it controls your out-of-pocket cost is in a Medicare Advantage plan, you pay the same copay for a hospital stay or a doctor visit. Whether that visit costs $100 or $10,000, you pay the same copay. So you do have the copays. They all do have an out-of-pocket maximum. It varies from plan to plan, but there is an out-of-pocket catastrophic limit that you after that it pays 100%. But if you go outside the network, you might have to pay 100% of the cost. So this person, that's why I say you need to choose when Medicare becomes your primary pay, either at 65 or if you work past them and you retire. You need to pick what you want for the rest of your life, what you're going to want when you're 90. Because while you can't switch between these two, it becomes difficult. This person here decided when he turned 65 to go with the original Medicare. He wanted choice, bought that Medigap plan. He started talking to his neighbor over the back fence. Who said, I really like my Medicare Advantage plan. I love it. So he said, yeah, that sounds pretty good. No premium. I'll save some money. I'll go take that Medicare Advantage plan. Well, when you switch from original Medicare to Medicare Advantage, if you had a Medigap policy, you have to drop that. If you don't like that Medicare Advantage plan within 12 months, you can switch back to original Medicare and get that same Medigap policy from the insurance company that you had before you joined it. So you have 12 months of a trial period. Let's say this person stayed more than 12 months. So this person went back in less than 12 months. The insurance company had to sell them that Medigap policy again. This guy jumps around a lot, as you'll see. After 12 months, though, this person stayed in there more than 12 months, that Medicare Advantage plan. And he's gotten sick in the meantime. He says, I really like having choice. I want to go back to original Medicare. But he's gotten sick and he's older. He tries to buy that Medigap policy. The insurance company says, no, you're sick and you're older. We don't want to sell you this any longer. So he's stuck in the Medicare Advantage plan. So even though it's technically you can switch, in reality, it becomes difficult to switch between the two. Make the best decision you can when Medicare first becomes your primary payer of what you're going to want for the rest of your life. Certain states have some other protections on that, but as I said, once again, not the state you or I are in. Now, another mistake people make is zero premium means free or low cost. This person joined a Medicare Advantage plan because they say there's no premium. Premium is what you pay every month to be in the plan. So that was free. He joined the Medicare Advantage plan, doesn't have to pay anything to them to be in the Medicare Advantage plan. But every time he goes to the doctor or hospital, he does have a copay. So he still have a copay with those plans. It's not free, it just means you don't pay a monthly premium to be in the plan. So these are the pitfalls for the Medicare type. Zero premium doesn't mean free. You still have those copays in a Medicare Advantage plan. Think about very seriously about the rules of each one when you're making that decision. Don't pick the same plan just because your spouse or a friend picked it. For example, somebody is in original Medicare. You've got a couple both in original Medicare, so buy the Medigap policies. They need to pick a Part D plan for prescriptions. More than likely, the best plan for the wife is not the best plan for the husband, unless their medications are exactly the same. They need to use the tools out there to pick the best plan for each of them to maximize their savings under these plans. And the Medicare and healthcare cost is really something for your financial advisor. That's all I have. Let me think about one last thing before I open up the questions. If you want help picking your Medicare plans, if you want help choosing where they go with original Medicare or going with Medicare Advantage, or if in original Medicare want help picking your standalone Part D plan, there's help out there for you. What Medicare has done, because they don't have offices everywhere like Social Security does. So what Medicare has done is they've trained people that work at nonprofit agencies. They pay these nonprofit agencies, have these people out there to provide at no cost to us help with Medicare planning. They can help you choose between original Medicare or Medicare Advantage. Once you make that decision, help you pick your best plan. And as I said, help you pick your best Part D plan if you're in original Medicare. And you can use them more than once. If you're in original Medicare, for example, you picked a Part D plan based on the medications you were taking. But then 5 years later, your doctor prescribes a new, very expensive medication that's not on your current Part D plan's formulary. In that open season in the fall, you can switch to a plan that'll cover that medication. They can help you do that. Go back to them again, say, help me find a plan that's going to cover this better. Or if your Medicare Advantage plan no longer meets your needs, you can switch to another one of those for the next year. Go back to these same people that Medicare's trained to help you do that. They're very well trained. I used to help train the ones in North Texas when I worked at Social Security, very well trained. They're on straight salary, not a commission. Their only job is to make sure they get you in the best plan. They usually work for your local area agency on aging, your local area agency on aging. They usually work for them, but not always. But you don't need to worry about that. All you need to write down is 211. Everybody knows what 911 is. 201s have been around a long time, but a lot of people don't know about it yet. But it's not a Medicare number. It's for any social service information. And I've done seminars in North Carolina, and I know that 201 is available there because I checked it back then. If you have a question about any social insurance, any social benefit at all, dial 211. They'll get you in touch with the agency that provides that benefit. So when the time comes, just dial 211. Tell them I want help with Medicare planning. They'll get you in touch with those Medicare trained professionals. Once again, they help you decide where to go with original Medicare or Medicare Advantage. Once they do that, help you pick the best plan. They do a very good job. They're the experts. In this modern world, there's no more jack of all trades. Everybody's an expert in one thing. That's why I'm talking about Medicare. But don't ask me about anything besides Social Security Medicare because I don't know. That's why I need to go to your financial professionals for your financial questions and your financial planning. They're the experts in that. Whatever job you do, you're the expert in that. But the world's too complicated to know anybody else's job. That's all we know. These are the experts to help you pick your best Medicare plans. And Logan Linus, thank you for having me on here. Thank you all for your attention, and let's just open it up for any questions.
Yeah, thank you very much, Tom. While we wait for the questions to come in, I did want you to touch again on how we can ask Medicare to base the premiums based on the current year's lower income rather than the income from 2 years ago.
Okay.
That's very actionable, especially if someone's retiring this year or early next year. That's something they could do.
You actually go to Social Security for that. So that's part of Social Security's job with Medicare. So if your income's gone down because of retirement since 2 years ago, and you get that letter saying you have to pay the higher premium, then you contact Social Security and just say, I retired. And they'll tell you what they need for evidence. It's going to be pretty easy to do, but they'll tell you. If your income's gone down for a reason and it doesn't seem to fit in exactly to all those different life-changing events, but it might fit in just possibly, give it a try. I found that the Social Security employees generally, if it's a gray area, they're going to decide on behalf of you if they can. So if you're not sure it fits in that or not, give it a try. It can't hurt. As I said, if there's a gray area, they're usually going to decide in your favor on that. And so you'd contact Social Security for that. There's a form to fill out, but I'd give them a call first.
Okay. Let's see. We have a question. What if you buy your own health insurance?
I'm not sure what that means. You're like an individual plan you've got, maybe is what you're talking about.
Yeah, I believe it means if you're over the age of 65 and you have bought your own health insurance on the market.
There's no such thing.
Okay.
There's no such thing unless you don't qualify for Medicare, which would be somebody who just immigrated to the country and didn't have a chance to work. They can buy it on that, but you can't if you're entitled to Medicare. That benefit doesn't, the Affordable Care Act doesn't apply to people 65 or over who can qualify for Medicare.
Let's assume it was someone who's under 65 and is buying their own health insurance. What happens when they turn 65? What do they need to do?
They're going to throw a party because they're going to love to get on Medicare. And I live near Austin, and there's a new phenomenon here called Medicare parties. Usually people don't like to get older, but people love to turn 65 because quite often they get a lot better coverage at a lot cheaper price. So if they're not drawing their Social Security yet, then 3 months before they turn 65, file for Medicare A and B, then decide whether they want to go with original Medicare or Medicare Advantage, pick their plans, and they're going to have a lot better coverage at a lot cheaper price.
Okay. So I just got the word that person's question was answered in their set. We have another question. We read it. My husband works past 66 and plans to work longer into his 70s, and I am on his company's insurance. I am currently 68 and would like to get Part B for myself. Can I do this without penalty? Is the timeline for me? When is the timeline for me to do this? My husband will stay on his company insurance.
Okay, assuming that his employer has more than 20 employees, so assuming Medicare secondary, right, she can pick up Part B anytime she wants to. when Medicare's secondary like that, you can pick up Part B anytime you want to. I'd question her why she wants to take Part B though, because once again, after 6 months, she's lost that guaranteed issue right to buy a Medicare supplement when he retires.
Right. So my understanding is once she gets Part B, she's only guaranteed the specific Medicaid path she chose. She doesn't have guaranteed issue with anything else.
That's right. So once she takes Part B, after 6 months, if she wants to go buy a Medigap policy, she has to undergo underwriting. They can turn her down or charge her whatever they want to. So if she takes Part B now, and her husband retires in 2 years, and then she loses that employer's insurance, she may or may not be able to buy a Medicare supplement, a Medigap policy, because she's used up her guaranteed issue right that first 6 months she's entitled to Part B. So the only reason she really want to need Part B, in my opinion, is if she's going to drop her coverage from her husband's employer and go with Medicare's primary, unless she has a whole lot of doctor bills. And then she might want to take it, but then after 6 months, she no longer has that guaranteed issue right to buy that Medigap policy.
Okay.
So I just think what her situation is. And maybe she'll clarify why she thinks she wants Part B now.
Let's see. Do you have any books or any other resources you recommend people look at?
Well, Medicare's website and Social Security's website, I can't vouch for the accuracy of anything else. You know, you got to be careful who you're listening to or what you're reading, right? So, but Social Security's website, Medicare's website, they're very good. There is a lot of information they have to cover in there, though. But actually, Social Security's website is every year ranked in the top 10 of all websites, not just government, all websites in the world. But they do the best they can, and they do a good job, as I said, they're ranked high. But it's just a lot of information on there to have to find what you're looking for.
Okay. So the best place to look is direct to the source on
It is or contact Social Security too, or go to you. You know, somebody has a question about this, you can always send an email to you and you can send it on to me.
Makes sense. So another question. Let's say you're on Medicare Part A and B and have a Medicaid Advantage plan. If you go back to work for a company that provides health insurance, can you essentially turn off Medicare and get on that company's health plan? Does Medicare become secondary again?
It would, but I'd suggest they not do that, and this is why. That special enrollment period you get to take Part B right away with no penalty when you retire, if you work past 65, you only get one of those in a lifetime. So if they work past 65 and then retired, took their Part B in that special enrollment period, then a year later go back to work and then retire, they don't get that special enrollment period again. They got to wait till the first 3 months of the year to file for their Part B. And so if in that situation, I'd encourage them not to take the new employer's health insurance. Just stay with what they got with Medicare and don't take the new employer's health insurance. Keep Medicare primary.
Does the 6 month guarantee, do you get that 6 month guaranteed issue?
No,
And
you already use that up too. So it's the first 6 months you're entitled to Part B. You don't get another one of those either. There are some different times of guaranteed issue times, but not in that situation. For example, let's say somebody had employer's health insurance that paid second. They got to keep their employer's health insurance to pay secondary Medicare. If they lose that, they get a new guaranteed issue right. So there are some situations where you get them otherwise than that, but you don't get another one in that situation, no. So they might not be able to buy the Medigap policy again, as you said, if they dropped it. So if somebody goes back to work like that after age 65, I'd encourage them just to stay with what they got with Medicare and don't take the new employer's health insurance. That's what I would do.
Okay. Well, I'm not seeing any more questions. I'm gonna give everyone a couple of extra minutes to, if there are any late questions anybody's got. But while we're ready for those Q&A, one more time, I know Medicare is a complicated topic, and there are lots of complicated topics when it comes to retirement. And like we talked about before, whether it's your investments or your 401k, Social Security, Medicare, taxes, whatever it is. If you do have any other specific questions, if you want to set up a meeting, an appointment with myself and Linus, two CFPs, we'd be happy to talk with you for 30 minutes, an hour or two, just to answer your questions as best we can. I'm gonna put the Calendly link in the chat again, along with our phone number that you can call during normal business hours if you do have any extra questions. And I do see there's one more question that got dropped in. So Tom, I'm gonna toss that over to you. Can you touch on what coverage can be expected if you travel outside of the US for both original Medicare and for Advantage plans?
If you're going to be doing that, on kind of a regular basis, I'd encourage you to go with the original Medicare and get a Medigap policy that covers emergencies outside the country. Some of the Medigap policies do cover emergencies outside the country. And so if you do that, you don't have to buy traveler's insurance if you do that. So if you're going to be doing that more than once or twice, I'd encourage you to go with the original Medicare and make sure you get one of the Medigap plans that does cover those emergencies outside the country.
I think that's a good idea.
A lot of our clients really enjoy traveling. That was a great question.
Yeah, we do too.
But
we
I want
spent a
to
month in Europe last year. It was great.
Yeah, I want to reiterate something you touched on earlier that
Okay.
I have to admit is the first I'd heard of it, and that's 211.
Yeah,
It sounds like an awesome source of information if you're trying to choose which plan is best for you. Call 211, tell them what you're doing, and get directed to officially trained folks who are not incentivized to sell you at one particular plan.
that's exactly right. And they're local too. And so, when they're doing it, they, maybe on paper or on the computer, it looks like one plan's best, but they may know, well, this plan doesn't have good customer services area. It's actually one that looks second best is actually the best. They're local. They know that kind of thing too.
Yeah. Well, Tom, thank you very much. This has been, I think, very informative and very helpful. I'm not seeing any more questions coming in. I think we've had probably enough time. Maybe give 1 or 2 more minutes in case anybody's got
Okay,
a
sure.
straggling question or two. But everyone, thank you very much for your time. I know it's one of the most valuable things you have. I appreciate you spending a little bit over an hour with us. I'm not seeing any more questions, so I think this is it. I think this is goodbye. Again, if you have any questions that may be too private or too complicated for this open forum, I have put our phone number and a Calendly link in the chat if you want to give us a call or reach out to us. And again, thank you for your time. I think we'll go ahead and end it there. Tom, thank you for your knowledge. It was very much appreciated.
Thanks for having me. Have a good evening.
Thanks again, Tom. Bye, everybody.
Thank you.
Bye, everyone.
Bye.
Thank you.